Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guests are Don Geurtze and Brian Houle with the American Red Cross. Welcome to the show, gentlemen.
Thank you. Thank you.
Don, why don't we start with you? Can you please tell me what you do for the American Red Cross?
I'm the manager of our health and safety department, so we work with providing all types of courses in training for first aid, CPR, babysitting, and pet first aid, which is a fairly popular course in this area.
Okay, great. And Brian, why don't you tell me about your background? What do you do?
My background is I had opened a 911 emergency and non-emergency animal transport for animals in time of need.
Oh, great. Okay, so why don't we start? Don, how do we keep our pets healthy? That's the first challenge, isn't it?
It certainly is. You know, we all like to have our pets, we enjoy our pets, they're a member of our family, and we all think of them that way, but we need to keep them healthy just as we do our other family members. We need to be sure they get fed properly, they need to have proper amount of fluids, proper hydration, they need to be cared for by their veterinarian on a regular basis, not just when there's an emergency, but on a regular basis to see that they're, being looked at on a conscious basis to prevent things from happening, that they've had all their shots, that they're watching for any other emergencies or medical items that are developing. And we just need to be caring for them as if they were another member of the family.
I think one of the big things that you hear about is a pet left in a vehicle in the middle of summertime.
And certainly
that's not a good idea, right?
Certainly that's a problem. We hear about it all too often when someone goes shopping or goes someplace else and they leave the dog or the cat in the car. Cars get hot real quickly and the dog can become dehydrated or the cat can become dehydrated very quickly and overheated and go into heat exhaustion and heat stroke, being left in the car for a very relatively short time.
Now, some pets actually need to be followed with medicine, right? Obviously,
Yes,
that
they do.
has to be prescribed by a veterinarian.
Yeah.
And are there tips on the best way to administer meds to a pet?
If it's meds that the dog or cat are taking on a regular basis, people develop, the best method of controlling the animal while they're administering the medication. Sometimes it's a pill, sometimes it's a liquid, depending upon what type of medication it is, depends on how you're going to be able to do this the most effective way. You've got to be sure the cat or dog is, in a comfortable position where they can then, take that medication comfortably, not forcing it down them, but giving it to them in a way that they're going to be able to take it comfortably. So, getting the dog or cat comfortable first is an important part of how to get them to take the medication safely. There are some that could be mixed in with foods. There are some that can be mixed in with liquid. So there are ways you can do it and incorporate it in with other things, just as we would with a person.
And obviously, whenever the vet prescribes the meds, maybe everyone should just get tips from the vet on the best way to do it.
Yeah.
And
Each medication is going to be a little bit different. Each animal's a little bit different. They react differently to different things. The hardest time to give a pet a medication is during an emergency, when they're already, disturbed because of the situation of the emergency.
Right.
And they're a little bit hyper in that situation, and now it's even more difficult to safely give the pet meds. You don't want to put yourself at risk by putting your fingers in their mouth and being bitten by the animal, in the process of trying to give them medication. So
then you'll have your own emergency,
that's
won't
right.
you?
Now you're the next victim, and you're
Right.
the next person that needs medical care.
So there are a lot of different situations where we might need first aid supplies for an animal.
Mm-hmm.
Now, why don't we start first with, let's say, what we should keep in our home, a pet first aid kit.
We should have a pet first aid kit that will provide us with some things to deal with your typical emergencies. It's hard to plan for everything, but you can plan for the typical types of situations that occur, which can be wounds, insect bites, bee stings, things like this where you've got to treat the animal fairly quickly. We also have choking emergencies and things like that where we're going to have to deal with more of a medical type of thing. But you want to have a variety of things, everything from your typical, roller gauze that you can use to hold, a bandage onto the wound or dressing onto the wound, sterile gauze pads so you've got something clean to put on it. Obviously you want to wash the area first to get any dirt out of it because pets are out in the outdoors a lot and there's chance for dirt to get into the wound. You want to be sure you're washing that out thoroughly before you start bandaging it up. You can use, commercial rubbing alcohol to help clean it. You've got other things. You've got antiseptic cream that you can use on it.
So that can be for humans or animals.
These are similar types of things that you'd use for humans or animals.
Okay.
So it's a common first aid kit between both people and animals. There are some other things that are more unique. Obviously when you're dealing with an open wound or if you're having to deal with body fluids of the animal, you do want to protect yourself and be putting on gloves so you've got your hands protected so you're not going to get infected from items that they have. So having rubber gloves, but again, that's something you would use with a person as well. Having an extra leash available so that you can very quickly control the animal and keep them in the spot there. And you should even have a quick muzzle that you can put on the animal so that if they are riled up, you don't want them biting someone in the process of trying to be taken care of. So you've got some things that you want to have that are more specific to animals as you're going through the process. There are, some other things that you can use. A simple tongue depressor becomes a good splint for an animal's leg if they've broken a leg.
Right.
So you've got things that, they're not major medical items. They're standard things that you can find around the house. You can find your local pharmacy or through your local pet store that can, help provide you with the materials you need to take care of your pet, when that emergency occurs. You can do this. You can make your own kit, or obviously you can go to the store and you can buy, a pre-manufactured, kit from a commercial vendor that has them readily available with a variety of things in them, so that you can do it either way. It doesn't have to be, as fancy as an elaborate. It can just be the things you can gather at home.
And I would think that watching the expiration dates on the stuff is going to be important, right?
Anything that's a liquid or a cream or anything that would have an expiration date on it, just as we would watch it for helping a person, we want to watch the same type of thing for working with our pets.
And I'm imagining that it's probably better to have everything in one place.
Certainly.
Rather than fishing through all your cabinets and linen closet and everything else looking for the thing that you need.
That's why you make up a kit. It can be in a box. It could be a box like the commercial ones. It can be, in a pouch or a bag or something, but where you have a pet first aid kit that's ready to use when you need it.
Okay, and that's what we should have at home, right?
Right.
Now, Brian, do you have anything to add to any of these items or anything else to mention?
Basically, Don's covered it. When he pulled out the tongue depressor, I use paint sticks. I've gotten them from Lowe's. I've gotten the 5-gallon paint sticks, cut them in half, and it makes great splints. Especially, a tongue depressor if you're looking for, in a conscious dog or a cat, you can use them to not get bitten and take a look down their throat with a pen light and see if there's any obstructed objects.
Okay, so pen lights would also be helpful.
Yeah.
Okay, so let's say we're going on vacation or we're going on a hike. So let's address those two issues, and we're bringing the pet with us.
bring the pet first aid kit with you. It's just that simple. If it's small enough that you can easily carry, you can easily put it in the car with you when you go on vacation, so you have it right in the car with you. Don't leave it at home and think that the emergency is only going to happen at home. Keep it with you and bring it with you in the car.
And what are the other items that, Brian, why don't you address this, that someone should have other than the medical supplies when you're away from home?
Well, you can have food, water, maybe some treats. Say if the animal became lost, or you could maybe bring them in with a treat or their a favorite bell or a whistle in that first aid kit. Have a picture of your animal as well. All too often, I've seen people, hey, have you seen my animal? He looks like, or she looks like. If you had an exact picture, a lot of people could understand what that animal looks like.
Should they also bring the phone numbers for the emergency numbers
Absolutely.
with them?
If you're away and you vacation in a regular area, you might know that regular area where you vacation, so grab the local vet in that area or the emergency clinic, or at home have the emergency clinic for your animal on your refrigerator as well.
And people should realize that in the summertime, you can't really store this stuff in your vehicle, right?
Right.
It has to stay cool, because otherwise it's just not going to do well.
Wintertime, I went on a call during the winter, and the triple antibiotic ointment was kind of stiff, but you have to be ready. Sometimes your equipment isn't always ready with you.
Right. Now, other than what we've already mentioned, Brian, what else do you carry in your rigs?
In my rigs, there is an assortment of things. I have heat lights, for the winter. I have water, I have food, I have treats, multiple leashes, all kinds of muzzles that can fit from a Chihuahua to a St. Bernard.
Okay.
We have the paint sticks, we have for splints, we have dog leashes, collars, choke chains.
Oxygen, right?
Oxygen, we're granted onboard oxygen, and we can administer O2 to animals. We have the stretcher, blankets, multiple blankets, pillows, sheets, cat carrier, dog carrier. We have a control pole. We're not the dog warden, but
Right.
if we had gotten into an emergency situation where the dog had turned on me, at least I, with a 5-foot control pole, I could, attempt to control that animal. When I'm out and about, I don't like leaving dead animals in the road, so we also have a cat grabber that can grab control of a cat, whether we're using it on the job or we're in the middle of the road in Route 40 in the middle of the nighttime. I'll take the cat and I'll put it off to the side of the road and call the local law enforcement and let them know that I've completed that.
Now, should somebody attempt to move an animal on their own, or do you think that they should call for help?
Depending on one's health and and how big the animal is, you could hurt yourself. Usually, I bring one person with me at least, and the smallest dog can really be the heaviest dog sometimes because of the dead weight of the animal and the lack of cooperation, let's say.
Okay. So why don't we talk about the definition of a pet emergency? There's a fine line between the pet is panting a lot and not acting right and actually having an emergency. So what are the differences?
Well, there can be a variety of different situations that are going to occur. The panting can, at some points be just from exercise, and now they're going to need to stop and rest and cool down. Or it could be that they're having a breathing emergency as a result of having something caught in their throat and they're breathing abnormally.
Right.
And as a result, we're, needing to, sort of determine what led up to that situation. Just would with any other emergency, what was the cause of it, and what did we notice happening prior to the time that we found the animal having this situation. So a lot of it is looking back at what's happening, what's caused it? Is the situation safe for us to enter? Could it be they're panting because they don't get good oxygen because they're in a toxic fume area? And we don't want to walk into that same area where the toxic fumes are.
Right.
We need to get more advanced medical personnel or emergency personnel there to, clear those fumes before we go into it. So that it really depends on what the situation is around the whole matter of the emergency.
But people should also think about the general personality of their
That's right.
animal, right? And
Yep.
they kind of have a gut feeling when something's wrong.
Right. That's the part about, someone else coming in and providing emergency care for the animal versus the owner of the animal that's, with them all the time, that knows and understands that animal. And, really, whenever possible, the owner of the animal should be with them, when other care is being provided, because it's going to help that animal stay calm and be able to be more effectively treated.
I could touch on another emergency, automobile accident, or
Right.
the animal runs out in the road and gets hit. Obviously, the owner is definitely going to want to get to that animal. You have to make sure that traffic is cleared. You're not in the middle of a highway. You're not going to get hit or injured. Like Don said in the opening, that animal emergency, you could be the next victim, whether it be being a victim from that animal bite
Right.
or from an automobile, that strikes and hurts you.
And I'm imagining if you stick your fingers in an animal's mouth when they're conscious, they might see it as a threat.
Yeah, but absolutely, and you have a very high risk of being bitten.
Oh boy. Okay, so Brian, let's talk about some other examples of emergencies that that pets can experience.
Well,
There's many, aren't there?
one evening we were called into Schenectady. Besides the automobile accident, we had a person that was intoxicated and knew that he couldn't transport his animal in an emergency to the animal clinic.
Okay.
Luckily, he had called the emergency clinic here in Latham, and they had dispensed my phone number to him, and his cat was having a urinary tract infection. It was his urine. He was a male cat, neutered, 13, 14 years old, still in good health, but he just was unable to urinate, just peeing in spots and not regularly. And what was happening is the toxins in his urine was backing up inside of him, which would have quickly
That's dangerous.
killed the animal.
I mean, I think it's probably pretty much the same emergencies that humans have, right?
Just a different flavor.
The biggest problem with it is, though, they can't tell us.
They can't talk.
They can't talk.
My leg
So they
hurts.
can't tell us that there's something wrong and what exactly the problems are. They can't tell us that my stomach hurts. They can't tell us that my leg hurts. They limp, but they can't tell us what's wrong. And we have to try to find that out for them.
Okay.
On one occasion, the international sign for choking is, you're going for your throat, or you can't, you're going towards
Right.
your mouth. Dogs can exhibit behaviors where they're putting their paw near their mouth because they can't breathe. Something could be
And there's
obstructed.
probably a lot of things a dog could choke on, right?
Yeah.
Anything in your
Absolutely.
house, pretty much.
And anything in your yard, a rock, a stick, plastic piece of toy, children's toys.
Okay, so that's basically like obstructions.
Mm-hmm.
Probably a pretty common one is going to be bleeding emergencies, right? Whether they're bitten or whether they step on something sharp or something like that.
We had an emergency in Troy where the owner was out walking his dog, and it's stepped on broken glass, and the pad of his paw is just ripped open very nicely, and he was bleeding everywhere. I immediately got onto the scene and put gauze and continued to wrap it. As it was bleeding through, I continued to wrap it. I don't want to take what I've already packed on there because of a possible clot. If you're going to eventually clot that wound, you don't want to unclot it by taking off what you've
Right.
already packed on. So the more can be, the better.
Okay, So why don't we start at the basics of dog first aid? Now, Brian, you have a dog,
Absolutely.
right? What's the first thing you have to check for a dog?
Well, the ABCs of the dog.
ABCs.
Absolutely.
It's the same thing as a human, right?
Absolutely.
Okay.
You're going to check for airway, breathing, and circulation. Airway, if your dog is conscious, again, you do not want to put your hand in his mouth.
Okay. And the humans, they say, if they're talking, they're breathing.
Right.
So maybe dogs, it would be if they're barking, they're breathing?
They could, but I don't necessarily think they would be barking. I don't know.
Each dog is going to react differently to a situation.
Could be whining, barking.
Yeah. And
If there's noise coming out.
yeah,
Right.
is
an
what
unusual
I'm saying.
sounding breath, where their breath exchange sounds unusual to what
Yeah.
the normal would be.
And that's
You know, and people that have pets know their pets, and they know what they sound like,
right.
and they can hear their pet breathing, on a regular basis, and they know when something doesn't sound normal, and that's what you're looking for, is the abnormal breathing sounds.
So we have an emergency. What I learned in many of my first aid training classes was, number one, call for help, right?
Right.
That's number one.
A lot of people.
Number two, assess the scene. Make sure it's safe. So
Absolutely.
you're not going to get hurt. And then there's airway, right?
Correct. A lot of people don't know that you can actually call for help. That's where the Hoosick Valley Animal Rescue Squad comes into play. If you have the phone number, you can call it and at least get somebody in motion as you would an ambulance in the 911 system.
328 TATS.
Yes, 2287.
Okay. So let's start with airway.
All right,
What do we have to do?
We would check and open up the dog's mouth or cat's mouth. Make sure the tongue is in between the two front teeth, and look. If you have a pen light available or a flashlight, you can take and look down the animal's throat and see if there's any obstructions. If the dog is unconscious, you can do a finger sweep to see if you can get anything. If no result,
Or maybe use a
tongue depressor
or something like
something.
that. Anything that serves as something
Wait.
that's going to go into
absolutely,
their mouth, right?
you can check for circulation,
Okay.
breathing, airway, so you're breathing. If he's not breathing, you can obviously check for circulation. Circulation, you can check their gums. If their gums do not, the capillary refill doesn't come back quickly,
So
or
gums should be red,
right, fluent.
not white,
Right,
gray.
white. If they're white, gray, or black, but then sometimes you have animals with black gums. You can always look into their eyelid, and if it's pink in their eyelid, they're getting proper circulation as well.
All right.
So don't let it be fooled just because they have black gums. But if they're blue or white, you've got to act a lot quicker and start your CPR. You can look for circulation behind the animal's front paw. There's a pressure point here. You can check in the animal's groin area right there, and you can also check in the rear paw here.
Now, we have our own pulse in our thumb, right? So should we use other fingers?
I would
To
use
check?
I wouldn't really necessarily use the thumb. You can use your middle finger or index finger, however you want to call it, and just roll the dog over on its right side, and then you can get in there very easily.
Oh, my goodness.
At first, it's not the easiest thing to do. Like they, teach in the pet first aid class, practice does make perfect. So while you're not in an emergency, find out and feel for your dog's pulse and see if you can feel it and see what you would feel when it's not an emergency, and then you can relate when you do have an emergency. You can be prepared.
But it's obviously in different spots than human pulses, right?
Absolutely.
Oh, my goodness. All right. Anything else to add about
Well, if
doggy ABCs?
absolutely, if you find that your dog is not breathing and now you don't have any circulation or any pulse, you want to start some rescue breathing for your dog or your cat. You can do mouth to mouth, which is called mouth to snout.
Snout.
And you would take the dog's mouth and his nose and give him 4 to 5 rescue breaths. You want to make sure that you have good chest rise, so you know that those breaths are getting into the dog. If that doesn't work, then you're going to start your compressions. On a larger dog, you have 1 breath to 10 compressions, and you continue that until something happens or your 20 minutes is expired. Usually when you work an animal for 20 minutes, if it goes past that deadline, there's not really much you're going to do to save your pet. So the first indication your dog has or cat has a problem, you want to get to the ABCs and get right to your CPR and get moving.
So I know that for humans, you have to call 911, call an ambulance, so that help is on the way. But what do you do with your dog?
Well, I mean,
They can call you, right?
they can,
But
or they
they
can,
should be on the way to the vet, is what I'm
right,
saying.
or they can get a family member that can drive. My suggestion is, don't just call me. Call the American Red Cross and check out the pet CPR first aid course so you can be prepared and know these skills, especially if you have a team at home where husband can drive, wife can administer CPR.
That's true.
You can't do both and drive at the same time. And when the program first started, my program, and opened up, you've got a lot of big guys. Hey, my dog's got a problem. I'll just throw him in the truck. And well, what kind of care is that animal getting on the way after you've thrown him into the truck? Mind you, throw him into the truck. You might want to get yourself a board or maybe even a stretcher, something with some kind of straps, so you can lay the dog down so it doesn't continue to injure itself as a human would if they were backboarded from an automobile accident or something like that.
So what are your tips on bleeding control?
My tips on bleeding control are, if you have cut the animal's nails by accident and you have a bleed from the toe, or something like that, you can grab yourself a talc pen from a local Walmart or drugstore, and it actually helps clot up that area. Then you would wrap it. If you have like a cut on the paw, you can wrap the wound and continue to wrap it so the dog doesn't take and try to rip the bandage off. Grab yourself an extra sock, slip it over, and then wrap that as well. So then they're gnawing at the sock and they're not actually getting at the bandage, which is protecting the wound. We had an emergency in Albany where the dog's ear was pretty much ripped off, half of it. It was bleeding everywhere. I wrapped the animal up, I wrapped his ear, and before you know it, he shook it right off and blood again. So what we did this time is I wrapped it again and used an ace bandage. And I had an ace bandage handy, and I just wrapped his whole head. He looked like a mummy, but it worked.
Whatever works.
Absolutely.
Right?
So there's different situations that you can get into. Sometimes they're deceased animals. Really haven't gotten into the emergency, like having to do CPR, but I'm ready and willing and able. So when it goes down, I'll be ready.
Excellent. Okay, Don, can you talk about what someone could expect from the American Red Cross Pet First Aid class?
Certainly. We run courses about every 3 months or so. It's called Pet First Aid. And in that course, we go over a lot of the things we've talked about here today, everything from wounds, how to care for bleeding issues, how to care for a broken bone, to splint the leg, or things like that. We get into the obstructed airway issues or breathing emergencies, as well as rescue breathing and CPR for the animals. So we're covering a wide variety of skills and situations that a pet owner may have to work with when a situation occurs, and we're doing it for both dogs and cats. So it's a combination course for either type of pet.
And you teach what happens when the animal decides to have children, right?
And that's included in part of the program, some birthing
Babies.
issues. And that's also in the pet and dog first aid books that we have. We have regular books that are printed through our national organization on cat first aid and dog first aid. So we have those available as resource and reference materials for the people that are taking the course, or just come in and buy the book and have it as a resource at home. So we do have those available. We go through the, one of the things mentioned before, choking skills. Because what do you do when that animal chokes on something? And dogs pick up a lot of things when they're out in the outdoors playing. And, I've seen dogs pick up a ball and put it right inside their mouth. And is this going to cause a choking?
Balls are big culprits, right?
Balls are big culprits. And if it's too small, it could get down into the throat and cause a choking situation.
Yeah, I would think that, baby proofing for a human is important, but taking care of your house to make sure there's nothing the animal's going to choke on might be more challenging.
It is.
Very interesting. Okay, Brian, one last comment. Who should not adopt a pet?
Well, in this day and time with the economy, people that can't afford to adopt a pet, bringing a pet home is a great thing. And surprising a child, or even bringing home an Easter bunny during Easter time, it's not for everybody. If you can't afford to care for that animal, it's just not a bowl of water, a bowl of food, and or a cat litter box, a dog leash, basic little supplies. You got to think about catastrophic times when say the dog gets hit by a car, or is choking, or has a cut. For instance, the dog with the ripped off ear. That person had no money, and pretty much exonerated from the service, and working on donations. And we used the donations to transport that guy. His bill was over $700. The gentleman from Schenectady, $1,300 for an emergency surgery on a cat. Right. Myself in the same position 2 Octobers ago. My cat needed an $1,100 surgery and died, from complications to the beginning of the surgery. It's just, if you can't afford an animal, do not get it.
Okay. So they have to see it as really a financial responsibility or anything else. And
if you do have an animal, and I suggest that you have a rainy day fund, so you can draw from it, or an emergency credit card, because animal hospitals and veterinarians, as sad as it is sometimes, are not like regular hospitals. We can take ourselves into the hospital and say, fix us and bill us later. They can't deny you care.
We have Medicaid.
Or Medicaid, or whatever. But
health insurance.
You just can't drag your dog in there and say, fix my dog. And they're going to be like, where's the checkbook? Or, what's the method of payment?
Right.
One of the other issues is not only being able to afford financially, it's being able to afford the time to take care of your pet appropriately. Dogs need to be walked on a regular basis. Cats need to be taken care of appropriately. You need to have the time available to be able to take care of that pet as well. Someone who's out of the house 16 hours a day, isn't providing much company, in a sense, for that animal. And that animal's just left alone all the time. So they really need to have, not only the financial ability, but the time ability to take care of the pet as well.
That's true. Okay, so let's just finish with, a website, how to contact the American Red Cross.
We're at www.redcrossneny.org.
Okay. And then the telephone number.
The telephone number is area code 518-458-8111, and ask for our health and safety department.
Okay. And Brian, do you want to mention the phone number again for the
Certainly.
Hoosick Valley Animal Rescue?
We have a website as well. You can go to www.hvars.com.
Okay.
Or you can call 518-328-2287, which is the equivalence to CATS, C-A-T-S.
But you treat all animals, right?
Yeah, I mean,
Okay.
We even helped out wildlife rehabilitators and, transport animals, do a relay. And I've transported a squirrel. So it's just not a dog and it's just not a cat.
All right. Thank you very much, gentlemen, for coming in.
You're welcome.
Thank you.
Thank you for having us.
Thanks for watching. We hope to see you next time on Focus on Health.